Let's look at this summary of antivirals. This is part 1. We are going to discuss the drugs for herpes, varicella, CMV and HIV in this section. Okay. So first one, indications. Herpes and varicella can be treated with Acyclovir or Valacyclovir. So these two drugs, uh, commonly you are going to prescribe Valacyclovir, oral drug, Acyclovir, oral topical and IV is available. Especially when a patient coming with a like a very life-threatening chickenpox, you can give IV Acyclovir. One of the reasons is this is a virucidal drug. That means all these first six drugs have mechanism of action to inhibit or completely break DNA of virus. So they inhibit viral DNA, therefore it is virucidal. Okay, it's going to kill all the viruses. So Acyclovir, first drug. So if you learn everything about Acyclovir, that's all you need to know about Valacyclovir. One additional point is this has a longer half-life because this is adding a valine. It's like a val tail. It's just a prodrug. Valine, when it added, it's going to have a well tolerated drug comparatively Acyclovir, and a comparatively lesser toxicity and a longer half-life. So Acyclovir, study that one, most commonly asked question, either of this. Then study the next one, CMV. You can treat with Ganciclovir or Valganciclovir. These are modified drugs from Acyclovir and Valacyclovir. Okay, so Ganciclovir, remember this spelling, both pronounced similarly, cyclovir, but first one is CYCL and the second one is Ganciclovir is CICL. Okay, both of these. So here also this is a prodrug of Ganciclovir, therefore Valganciclovir, valine added. So other than that, I don't want you to study anything special about this. Just study these two drugs separately. That's all you need to know. Very simple to understand. Another point to remember, this is some patients get a like a in resistance for resistant to Acyclovir or Ganciclovir. In that case, you can use other two drugs. They are resistant. They can treat resistant varieties. That reason is because these two drugs does not need any viral activation. There comes with a phosphate group, therefore it is directly human cells will activate, or therefore Foscarnet and Cidofovir. So these are two drugs we are going to discuss. Okay, so just look at one by one. So HIV is the second part we will discuss. First one, Acyclovir. What are the three things I want you to remember? Acyclovir or Valacyclovir. Keep in mind, indication, always keep in mind. Herpes, oral or genital herpes, or varicella, chickenpox or shingles. You can treat by either of these drugs. So indication you understood. What is the mechanism of action? These two drugs can be activated inside the virus. That means they need viral thymidylase kinase to activate. Once it activates, it's phosphorylated by human cells and then inhibit viral DNA polymerase. Thus, the overall picture is inhibit viral DNA. Very good. Mechanism of action is good. The next adverse effect is the major one to remember. Another major point. These two drugs cause nephrotoxicity. So renal failure can happen if it is long-term treatment with this patient. So what is the reason? Easy to remember. Acyclovir is a very small molecule. It is very much insoluble in urine, acidic urine. Therefore, it start accumulating as crystals. Therefore, crystalluria and renal failure. Okay. So when they created next two drugs, so another point if you wanted to distinguish these drugs, Valacyclovir is once a daily, Acyclovir is oral twice daily, and Acyclovir topical is available. Valacyclovir does not have topical. What is the reason? Keep in mind, reason, Valacyclovir is a prodrug. It has to get into human body, and that has to act, human cells have to activate Valacyclovir. It has to chop the valine and then change into Acyclovir. Then the next step onwards, it worked exactly like Acyclovir. That is, it needed viral thymidinase kinase to chop that, sorry, activate that phosphorylation, and then it's going to work. Okay, the next section is Ganciclovir and Valganciclovir. What are the three things to remember? When they created these drugs, they were worried about the earlier drugs nephrotoxicity, but this drugs does not have CMV. First two drugs, Ganciclovir and Valganciclovir, does not have nephrotoxicity, but they have a unique adverse effect, that is bone marrow suppression or myelosuppression. That is a major one to remember. Then remember the mechanism of action similar to Acyclovir. And what else to remember? Those are the major thing to remember in this one. Then next two drugs, Foscarnet and Cidofovir. Let's talk about Foscarnet, right? So this drug is commonly used, either of these drugs. If a patient has CMV retinitis, especially in patients with HIV, you can give Ganciclovir or Valganciclovir, or you can give the, if you are worried about resistance, Foscarnet or Cidofovir you can give. So these two drugs also have the same adverse effects in the first drugs. Those are nephrotoxicity. But when you give Cidofovir, if you give IV slow infusion along with the probenecid, it can reduce the accumulation in the nephrons, and also it can reduce the nephrotoxicity. Other than that, keep in mind these two drugs have the adverse effects nephrotoxicity, but these two can treat the resistant forms of herpes varicella or CMV virus. Okay, so the next section is HIV. So the first part is done, HIV. So out of these HIV drugs, most commonly asked board question, at least people get like you will get two questions each year. So I'll tell you major points. Okay, so this is what you need to remember. This is not complicated. So three things to remember. Okay, before that, what is ART? Antiretroviral therapy. And HART means highly active antiretroviral therapy. What is highly active antiretroviral therapy? They are going to use multiple drugs. So we use multiple drugs, three different targets of the virus is three different enzyme. I want you to remember: integrase, reverse transcriptase, and protease. That's it. So let's look at it. What do you learn? We are going to start from zero. For HIV treatment, we can use a drug which can inhibit integrase enzyme of the virus. They are called integrase inhibitor. Okay, three major drugs are there, one at least remember. Then you have some other group, those are the major group. We have an enzyme called reverse transcriptase, so we can inhibit with that reverse transcriptase, or we can use protease inhibitors to inhibit protease of the virus. Then there are entry inhibitors and fusion inhibitors. So let's look at one by one. Okay, integrase inhibitor. How do you identify this drug? Any from all these drug lists, look at the Tegra, Tegra. Tegra, if it is there, Raltegravir, Dolutegravir, or Elvitegravir. I remember like a rat, elephant, and a doll. But whichever way, at least remember Raltegravir first. Okay, so this drug, what is the mechanism of action? Easy, it is in the name. This is going to inhibit integration of viral DNA into host DNA. Perfect. Mechanism of action is done. The next one is about the indication. Of course, this is one of the first line drug for heart therapy in the combination therapy. Okay, so one of these drugs will be useful. But I want you to remember one more point. This drug is also used for PEP, post-exposure prophylaxis. So if a patient is worried about worried that that patient is exposed to HIV virus, you can use Raltegravir oral, plus there is a combination drug, that is tenofovir emtricitabine. So we will discuss those, but keep in mind this drug is in one of the combination of post-exposure prophylaxis in patients. Okay, in addition to heart HIV treatment. Okay, so two indication I want you to study for this drug. Then if you talk about like other point, not much to remember. Then the next one is reverse transcriptase inhibitors. Okay, let me explain this very simply. How do you remember reverse transcriptase? There are two methods. One, you can use a drug to directly binds to reverse transcriptase and inhibit its function. Very good. Okay, so the second step, we can use some other group of drugs. We can block the function of reverse transcriptase by replacing the nucleotide. Okay, one more time. We can use two types of drugs to block the reverse transcriptase. One, you can directly inhibit reverse transcriptase by binding on it. Okay, good. Then another, a group of drugs we can use it, which can, we are using fake nucleotide. That means instead of nucleotide you have drugs. Therefore, reverse transcriptase cannot function. That's it. So here we go. The name of fake nucleotides are nucleotide reverse transcriptase inhibitors. Very good. That's a lot. But the other one, the first group is directly binding and inhibiting. They are called non-nucleotide reverse transcriptase inhibitors. That's it. So they are not nucleotides. That's the reason. NRTIs and NNRTIs. So let's look at the first NNRTI. First one drug, at least to remember, Efavirenz. So how I remember this drug is everybody's favorite virens. Efavirenz. Efavirenz. Okay. So this drug, I want you to remember first mechanism of action. Okay. This is a reverse transcriptase inhibitor, specifically NNRTI. Perfect. Directly inhibiting. Then you have to learn about the adverse effects and contraindication. Adverse effect, this drug actually causes, this is a very small molecule, past blood-brain barrier. It can affect the CNS symptoms. So instance of patients report vivid dreams and insomnia. That is an adverse effect because it can pass into brain. It has a tendency to bind to neurons. That's the reason. Okay, so then it is contraindicated in pregnancy also. Okay, that's it. Let's move on to the next group. Those are nucleotide reverse transcriptase. Okay, I want you to remember all these at least 4 drugs. Of course, there is a long list we will discuss, but first commonly asked board question is Abacavir, Zidovudine, Tenofovir, emtricitabine. So how I remember is first A drug, then the Z drug, last drug. So it's actually these are the first one of the first drugs, but just remember this way. Abacavir. I want you to distinguish Abacavir from Acyclovir. Remember, Acyclovir is not the direct treatment for HIV, but these are for herpes and varicella. But this one, Abacavir, what are the major things to remember? Why it is commonly asked board question? Reason, indication you need to remember, and also it can cause a life-threatening adverse effect if you treat in a patient with a mutation. So that is why they are commonly asked, because about 88% of patients can have HLA-B mutation. So that's how I remember HLA-B mutation. So keep in mind, if there is a mutation in a patient and if you treat Abacavir, patient can develop hypersensitivity. That is very bad choice, right? So therefore, you should not prescribe that and also give the test to identify that. So that is why board like to ask that question. Then Zidovudine. What is the major thing to remember? Zidovudine, how I remember is like a Z pregnancy. So this drugs in pregnant patients, I will talk about that. That's important to remember. Then Zidovudine, this one can be indicated for children's, adult, well tolerated drug. Okay, during birth, perinatal transmission, to prevent perinatal transmission, you can give Zidovudine. How I remember is in United States, almost all the females who have HIV infection, they will receive Zidovudine just before the delivery to reduce the viral load, because this drug passes blood-brain barrier and also it passes placenta. Therefore, we can give this drug so that you can reduce the viral load in the viral transmission. And also this drug is also used to treat infant ART prophylaxis. okay, after the delivery. So that is the major thing to remember for Zidovudine. It's a combination drug. Then tenofovir. So tenofovir, this drug is also useful to treat both HIV and Hep B. That means if a patient is co-infected, you can use that one, and also this can protect from HP also. This is a very highly potent drug, commonly used to combination. So remember earlier I was talking about this drug used to treat in patients that are worried about post-exposure, right? Post-exposure prophylaxis, Raltegravir plus tenofovir emtricitabine combination drugs you can give. So I want you to remember that. Another point I want you to remember for tenofovir indication is, of course, we can use it for heart. In addition to that, tenofovir emtricitabine combination drug can be used for pre-exposure prophylaxis. I want you to remember for board exam. Pre-exposure prophylaxis, that means if you are worried about, if you are a physician, you are exposing, chance to expose to HIV patients or partners, they can take tenofovir emtricitabine combination drug. Okay, so that is for indication. Then another point to remember is, maybe the last point to remember for this tenofovir drug independent, this drug can cause, if it is treated in patients, especially in elderly patients, this can reduce bone density. Therefore, always, even in adult and young patients, must give calcium and vitamin D along with tenofovir. Then next point, you have a couple of other drugs in this group. I want you to remember lamivudine, stavudine, didanosine, all those drugs are there. Okay, so one more point I want you to remember, Cidovudine and stavudine. I didn't mention all those, then it will be too much for you. That's the reason. Keep in mind, maybe board like to ask that Cidovudine and stavudine will not be combined. The reason, those both are thymidine analogues. If you have a same analog, you don't combine. Otherwise, you can combine with. See, I was telling about tenofovir combined with the emtricitabine, right? Same mechanism of action, but these are different analogs. That's the reason. So how I remember is Zidovudine not combined with the stavudine. Zebra and starfish will not dine together. That's all I remember. Anyway, another point, all these drugs I wanted to remember major adverse effects. Keep in mind this nucleotide reverse transcriptase inhibitor, this nucleotide, fake nucleotides, these can pick up by our human mitochondrial DNA. That is the reason in HIV patients who are taking these drugs, they are four, I wanted to remember four organs. So mitochondria in four organs can cause, type of tissues can cause adverse effects. One is their adipose tissue. The mitochondria of adipose tissue can pick up these drugs and cause adverse effects. That is adipose lipoatrophy. That is a major point. Then next to peripheral neuropathy. Peripheral neurons, the mitochondria in the peripheral neurons can pick up these nucleotides, therefore. And then liver and pancreas. That's why patients can get pancreatitis or sometimes hepatotoxicity. So major points are lipoatrophy and peripheral neuropathy. Okay, why? Just remember one point, these fake nucleotide can be our human mitochondria can accidentally pick up these. They were assuming these are normal nucleotide. That's the reason this adverse effects. Okay, very good. Then protease inhibitors, very easy. Next section. So protease inhibitors, commonly asked question, one of the pharmacokinetics portion. And other than that, I want you to remember the mechanism of action first to study. All this name of the drugs and the mechanism of action. What is the mechanism of action? They are protease inhibitors. The drug names Intinavir, Ritonavir, Adasanavir, Darunavir, Cobicistat. Okay, so how I remember is Indian Rita At-a Daru contest protest. So why I remember that way is protest protease inhibitor. It's not contest, but actually cobicistat. This is why I put a different color, is this is not a HIV drug, but cobicistat, most commonly asked board question in HIV drugs, cobicistat or ritonavir in the ritonavir, that's how the pronunciation, ritonavir from the protease inhibitor. What is the reason? Ritonavir is a CYP inhibitor. If you combine with some of these drugs or some other drugs in the list, so especially Elvitegravir or Ataclovir or Darunavir, if you combine ritonavir or cobicistat, you can inhibit the CYP interaction. So that means these drugs can very fast metabolism by CYP enzymes, so that if you add these either of these drugs, you can keep these drugs in, that is Ataclovir, Darunavir or Elvitegravir or other drugs are there. So these drugs can be keeping in patient's body for long time. So very low concentration of these drugs can give long-term effect. Okay, so that is the reason ritonavir, it is a protease inhibitor. It is not individually using nowadays, only combining with other drugs. Why? This has an additional effect of very good CYP inhibition, specifically a potent CYP3A4 inhibitor. Another board question, cobicistat. Why? Cobicistat is a modified analog of ritonavir. Cobicistat doesn't have any antiretroviral activity, but if you give with any other antiretroviral drugs, it can inhibit the inhibit the CYP enzyme, so that keep the viral drugs activity. Okay, so those are the major one. Study individual drug adverse events. For instance, Integrase has a nephrotoxicity and also bilirubinemia. If you get times, you can look at all those. And last two drugs. Okay, so entry inhibitors. So this drug, the drug name is Maraviroc. So this one also called chemokine receptor antagonist. Okay, so how this drug work? It's actually inhibit entry of virus into human T cells. So therefore, this drug actually bind onto CCR5 receptors of CD4 T cells. Okay, so T cell receptors, that's where it is going to bind, so that it's going to prevent entry of virus into the body. How I remember is, this is like a rock. It's like a rock blocking a door, right? Or a so that it's prevent the entry of virus into our T cells. Very good, it works very well. But remember, that is the reason this drug will not get much resistance, because it is binding on the CCR5 receptor of T cell. That is the reason this drug is not the primary drug, but if any other combination drugs are resistant, patients receive this Maraviroc. Okay, so similarly, another drug, fusion inhibitors. This is called enfuvirtide. So you must distinguish this drug with the Efavirenz. Remember Efavirenz, everybody's favorite virens, right? That was directly inhibiting the reverse transcriptase. This drug with insomnia and vivid dreams, those are the adverse effect and contraindicated in pregnancy. But enfuvirtide, how do you remember enfuvirtide? How easy to remember, N. So this is actually an inhibitor of enveloped glycoprotein GP, okay, glycoprotein 41, that is present in virus. So once this drug go and bind on the envelope glycoprotein 41, that site, it's going to inhibit the fusion of viral particle, viral cell, okay, to the T cell. So that's why enfuvirtide, easy to remember. Okay, so distinguish this drug with the Efavirenz and ritonavir with the Raltegravir. Remember, Raltegravir is an integrase inhibitor. Mechanism of action is super important, and the indication, this is used for post-exposure prophylaxis. But pre-exposure prophylaxis, keep only these two drug combination, right? Then Abacavir, always board like to ask the mechanism of action of this drug, and Abacavir is actually contraindicated in patients with HLA-B mutation to prevent hypersensitivity. Cidovudine, it is a drug which protects the patients, pregnant female, sorry, infants from contracting virus, HIV virus from pregnancy. But just mother will receive this drug. Anyway, so I think I explain everything. This is a long topic, and the next section supposed to be antiviral part 2 will be covering all these the drugs for Hep B and rhinovirus, influenza, etc. Okay, so but the next summary will be antibiotics. Okay, so antibacterial drugs. Thank you.